Hello everyone, I'm Davina Collier. I'm a certified iridologist, and a mom contacted me through the website findiridologist.com. She asked me if I would take a look at her daughter's irises to see what I can find out. Her daughter is 14 years old. She has a lot of symptoms and she's under a lot of stress because of it, and her mom wants her to feel better. And so she's working with a nurse practitioner, and so I'm going to pick apart her irises to see what else I can identify that she may have inherited genetically. And so I'm not here to diagnose, treat, or talk about preventing symptoms or anything like that. All I'm going to do is identify genetic stressors, okay? Okay, so I have the mom's letter that she emailed me. I'm just going to read it to you. She mailed it to me this month, October 2014. She says, "My daughter's issues began at an early age when she was 6. She was diagnosed with scotopic sensitivity and extreme sensitivity to light, which causes reading problems. She was then diagnosed with hearing and visual dyslexia, which also contributed to her problems in school. However, her health problems started when she was about 8 to 10 years old. She had always been a super skinny kid, and overnight we went to being overweight and looking swollen. She then began to have problems healing from sores and bug bites, things like that. I have had several tests done, which have all shown that she has minor health issues, but nothing severe enough to be treated by traditional medicine. I have always thought thyroid, but nothing shows up bad there. We have thought Cushing's, but then again, low to normal results there. Now we think PCOS, which is polycystic ovarian syndrome, due to menstrual problems, but I am not convinced either. She has high cholesterol and now elevated blood sugar, but there again, nothing enough to warrant treatment. We pretty much want any information to help us help her feel better. She has awful headaches due to braces and sometimes due to PMS and other times just because. There again, nothing bad enough to warrant special treatment, and any help that you can give us would be greatly appreciated. Thank you, Jana." Nothing that I say in this presentation suggests that this child has this problem. It just means that there's a genetic tendency towards it or a susceptibility towards it, okay? So just want to put that in there. Now, this is the right eye. This is her right iris. And here's the chart where the organs are located on the right side of the body. The first thing I'm noticing is a dark stomach zone here. It's gray. And it is a predisposition towards poor nutrient assimilation. This is the stomach zone right in here. And as you can see in here, this zone should be blue. We shouldn't even be able to see the fibers here. Okay, so yeah, there's a predisposition to stomach challenges here. The second thing I'm noticing here is these orangey pigments here, and it's going all throughout the nutritive zone, in the blood and the lymph zone also. They call it the humoral zone in iridology. But it's showing here, the orange color represents the pancreas. When you see orange in a person's iris, that's pancreas. It's a predisposition to pancreas insufficiencies. And so it looks like insulin not being utilized properly in the adrenals, the uterus, the bladder, the pelvic, the face, the throat, and the sinuses. And the third thing I'm noticing here is the thyroid area. The fibers have separated, and in iridology we call this rarefication of fibers. And as you can see, it's at number 3 here on the chart. And this is the thyroid here. And underneath it is the trachea, it's the throat area. And so those things here show up in the iris. And as you can see, the dark, let's say, is sort of grayish. The fibers have separated there, so there's a predisposition to weakness in these areas. And then there's something going on here in the bronchioles too, also in the thymus here in the chest. As far as a genetic stressor. And then down here is the liver zone, and again, well, this is the liver area representing at number 4 on the chart, number 4, and it's showing a replication of fibers also. And then there's some suppression going on, a sign for suppression here in this area also. Okay, so the liver also is a predisposition to some genetic stressors there. Yeah, all this is bladder right here. And then, of course, kidneys too. All right, and then I'm going to come over here to the lungs here. You have the upper, the middle, and the lower lobe of the lung, and this is the right lung here. And then down in here is the rib cage and the breast area. And there looks like there's a sign here for genetic predisposition to stress in the lungs and the breast and the rib area. Okay. And then the liver is over here too at number 8, as you can see here. This is liver. This, yeah. All right, and then I'm going to talk about the skin. The outer periphery here, the dark zone here, as you can see in the iris, is the skin zone, and some of it's lymphatics also, which is the immune system. It's dark, and that's a predisposition towards skin elimination challenges. So waste backs up and doesn't come out of the skin, and that's just a sign for that. It doesn't mean this child is having this issue. It's just a predisposition towards it. And then the other ones here in the circulation. This blue glow here represents the circulation, and it's showing you that there's a predisposition or genetic stressor in the brain area of circulation. This blue glow is also going around the iris also, so it's actually showing up in other areas, but it's dominant here in the head, in the brain area. And then this light color here, this is a sign of potential cataract or acid. And so there's it's a sign for acidity. And then there's some more predispositions that I'm seeing in this iris, but I'm just covering just a few items here. All right, so I'm going to move on to the next eye, the left eye. Okay, so here's the left, and as we can see, the iris pretty much looks the same as the right iris, pigment, signs, and the structure. There's just the degree of the separation of fibers and the colors. So what jumps out at me here is the uterus area and the orange pigment that's right over it. Orange, of course, represents the pancreas, and the separation of fibers shows that there is a predisposition or a tendency to uterus insufficiency. And then look at the stomach lining, it's also gray as well. And then over here, this is the chest area, which is where the left breast is, and also the rib cage. And then up here is the upper and lower lobe of the lung. And then, of course, sinuses are up here, and then the face comes over here, and then the throat area and the upper back is over here. It looks like there's some stress lines in this iris, but again, this is not the clearest picture. And so stress lines would stress the nerves, muscles, and the brain. And then the skin zone here is also dark, so it's pretty much the same information as the right iris. And so yeah, okay, and so I'm pretty much going to wrap this up. I just wanted to give you guys a quick preview on iris analysis.